Thank you for asking me to give this little description of my practice. I'm Dr. Tom Lagrilius, and we're here in my office. This is our consult room where we counsel patients often. Behind me is the website for the practice, the Skypark Preferred Family, Skypark Preferred Family Care. The practice is a concierge practice. We limit the practice to 400 patients per physician. The practice consists of myself and my partner, Dr. Nicole Lawrence. Both of us are geriatricians. She's an internist geriatrician. I'm a family practitioner geriatrician. The concierge practice started in 2005. I've been in practice for a long, long time at this location in a conventional practice since 1983. The practice sees patients of all ages. There is an annual fee. The fee varies with age. It's very low for young people and a little higher for middle-aged people and a little higher for seniors. The maximum fee is $2,400 a year. Membership fee. We're a fee for non-covered services practice, so we also do bill for services beyond that, but most of our revenue is from the annual fee. As again, we limit the practice to 400 patients per physician. We're actually in a growth mode right now. We're actually looking for a third physician to join the practice. We have about 6 employees. We have full x-ray facilities, ultrasound facilities, EKG treadmill facilities. We can do minor surgical procedures. We follow patients in the office, also at the hospital, take care of all our own hospital patients. We don't use hospitalists. We take care of patients in nursing homes. We make house calls. Both of us are available 24/7, 365 by direct access to our patients through cell phone. They all have our home phones and our email addresses and our text message numbers. And we invite them to call anytime for any reason. And we have same day or next day appointments. Each of our patients who are over 45 at least get comprehensive annual physicals, which are very detailed and take a couple, 3 hours in the office. We consider this an incredibly enjoyable practice to be in, both for the patients and for us and for our staff. As I said, there's a cap on the number of patients, 400 per physician. The fees for people under 35 are $800 a year for a membership fee. We see them for comprehensive physicals only every 3 years. That's how we keep the fee down. The fee for patients under 45 is $1,200 a year, and again, we see them every 2 years for comprehensive physicals. And everyone over 45, the fee is $2,400 a year, and we see them every year for detailed comprehensive wellness exams. There are discounts for families and for children. We do charge $400 per child for children who join the practice as part of the family, and there are discounts for couples and families in addition. We do not use hospitalists when we care for our patients in Little Company Mare or Torrance Memorial Hospital. We primarily use Torrance Memorial Hospital for our primary hospital work. We believe strongly that your own personal physician should be managing your care in the hospital. We coordinate your care, work with the consultants, and are there with you every day in the hospital. We make house calls and we also make home visits, particularly in our geriatric population patients, to assess their risks of falls and other kinds of difficulties at home. This is part of the practice. We make house calls when we feel they're indicated. We don't do them on a demand basis, on a same-day basis, unless we feel they're appropriate. So we do house calls, but it's at our discretion as to whether we think they're appropriate. Most patients who think they need a house call are much better served by being seen at a medical facility where equipment is available to do an assessment of the patient's situation more accurately. House calls are kind of limited to people who are shut in, who do not need detailed testing, and need some emotional support at home. We also manage our own hospice patients at home when that occurs. Both of us are geriatricians, so we have a tendency to focus a little bit on geriatrics, but we see patients of all ages. We have families with young children. Dr. Lawrence, being an internist geriatrician, doesn't see people under 16 or sometimes 12. I, on the other hand, will see children of any age if necessary. However, the focus is on seniors, and most of our patients are seniors. The patients can access us after hours on the weekends at any time, primarily by calling us on a cell phone or texting us at that number. Patients are given a membership card which contains our cell phone numbers, our home phone numbers, the office numbers, and our email addresses. We use all these methods for communication. We don't generally look at emails immediately, but I almost always check them at least twice a day. I'm board certified in family medicine and also in geriatric medicine. My partner, Dr. Lawrence, is certified in internal medicine and geriatric medicine. One of the best things about our practice is how well equipped the office is. We are a one-stop shop. We can handle a tremendous amount of medical issues in the office, considering the equipment we have. We have a full x-ray facility. We can do ultrasounds and do ultrasounds of carotids and abdomens and aortas routinely. We can do treadmill testing, cardiographic testing. We have audiology. We have pulmonary function testing. We have a minor surgery where we can do a number of procedures, remove skin cancers and close lacerations, and we can put casts on if necessary. We have casting equipment. We have a colposcope for colposcopies if they're necessary. We can do a number of minor procedures in the office that a lot of other places couldn't do. So we're pretty proud. We also have capacity to test bone density in the office. I'm on the staff of Torrance Memorial Medical Center, a first-class facility that's one of the premier hospitals in Southern California. We focused on that hospital. I'm the prior chair of the family practice department for several years. We work there very actively and almost always have patients in that facility. We're also, both Dr. Lawrence and I, on the staff of a little company in Mary Providence Hospital up the street a couple miles away. We use it less though. Having done my residency at USC, after coming down from the University of Washington in Seattle, I've always had a love of both universities. I am a clinical instructor in family medicine at Keck University USC Medical Center. We often have medical students from various places here in the office. In a week or so, another medical student is starting his third year 5-week family practice fellowship at our office, and I've done his third year 5-week family practice clerkship in our office, and I've done that with many students from USC also over the years. This one's from Albany in New York, by the way. The coverage after hours and on vacation when one of us isn't here is the other doctor. Since it's a partnership with two physicians, we back each other up if we happen to be out of town. However, it's also our policy when we are out of town that the patients can still call us on our cell phones anywhere we are in the country or around the world. I even have a satellite phone so that I can be reached when I'm out of cell phone coverage area. We pride ourselves on being immediately available 24/7, 365 to all of our patients at all times. I joke that the only time they can't get a hold of me is when I'm under general anesthesia. The other time they can't get a hold of me is when I'm in an MRI scanner, which doesn't happen very often. So we also have a backup of two other doctors in town who share a call schedule with us, who are also concierge physicians. We end up actually covering them mostly because both of them are solo rather than the other way around.
Hi, I am Dr. Nicole Lawrence. I work at Skypark Preferred Family Care, which is a concierge practice in Torrance, California. Basically what that means is that we accept an annual fee to take patients on, and in exchange for this we try to provide a higher level of care with a limited amount of patients so that our patients can really get the kind of care that they deserve. I primarily work with geriatric patients, but because I do internal medicine as well as geriatrics, I take patients of all ages. I really love what I do because of the gift of time that I get with each patient, primarily because we have a smaller number of patients. Also, I can see patients as much or as little as necessary depending on their needs without worrying about insurance companies. As far as the cap on the amount of patients we have, each doctor is limited at 400 patients, and this is because it's very challenging to take care of more patients of that, especially geriatric patients, in the way that we think is absolutely imperative. When patients are admitted to the hospital, which I try to avoid at all costs, but if they are admitted to the hospital, one, I try to do it directly so they can avoid the emergency room, and secondly, I will always be there to take care of them. Hospitalists are not used in our practice. We only take care of our own patients in the hospital, and we make that a priority. In addition, if someone is in the emergency room, we have the ability to go there and possibly discharge them if necessary, right from there if they don't need to be admitted. If a patient ends up in a nursing home, we will take care of them there. If a patient becomes very ill and homebound or ends up on hospice, we will continue to care for the patient throughout the duration of their or continuum of their care. In our practice, we do home visits quite frequently on a select number of patients. For example, our patients who are on hospice and nearing the end of their life, we visit on a regular basis because their comfort is our priority. We also do home visits on patients who are homebound and unable to come in. These visits are planned in advance. As you can imagine, it's extremely challenging to do on-demand house visits as we have a whole list of patients scheduled in the office for the day. But whenever available and appropriate, we go to see our patient where it's convenient for them. Here at Skypark Preferred Family Care, we take care of patients of all ages, but primarily we focus on adults and geriatric patients. I'm board certified in internal medicine, which means all adult medicine, and I do have a number of teenage patients as well. And then geriatric patients is my other board certification. So that's technically patients over the age of 65, but age is really just a number. When issues come up with my patients after hours, I am available to them via cell phone, texting, email, or through my home phone. They have access to all of those different avenues. If it's an urgent issue, I'm able to address it right then and there, or coordinate for care to be taken care of the next day if needed. It's a very nice way to keep my patients healthy and for them to feel like they have the appropriate support that they need and deserve. I'm board certified in internal medicine and geriatric medicine. At our office, in order to make things more convenient for our patients and also for us as physicians, we have an x-ray machine. We also do all our own laboratory work here in the office, so no one ever has to go to the lab. We have an ultrasound, which allows us the ability to look at multiple different organ sites. We do extensive wound care and have the appropriate wound supplies that are necessary. We also do minor surgeries here, so we have the appropriate equipment to do that. We have the ability to check patients' hearing, vision, bone density, all here within the office, which makes it really a one-stop shop. I see patients at both Torrance Memorial Medical Center and Little Company of Mary in Torrance. When I go on vacation, I'm covered by my partner, Dr. Tom Legrillius. Or if he's unavailable, we have a select group of concierge physicians here in the community that will cross-cover us for urgent patient issues. But for the most part, it's only going to be Dr. Legrillius who will be covering me.